She walked into the billionaire's room with steady hands and a calm face, and the first thing he did was flinch, not from pain, not from fear of his diagnosis, from her. The scars running up her neck, across her jaw, disappearing beneath her scrubs. He looked at them the way people look at something broken that should have been thrown away. "Is this a joke?" Marcus Vane said, loud enough for the hallway to hear. "Someone like you shouldn't be touching people like me." Elena Cross didn't move, didn't blink. What Marcus Vane didn't know, what nobody in that gleaming hospital knew, was that those scars were classified. If you want to find out what those scars are really hiding, follow this story to the very end. Hit like, and drop a comment telling me what city you're watching from. I want to see how far this story travels. The VIP wing of Harborview Crest Military Medical Center operated on a different set of rules than the rest of the building. The floors were polished to a shine that reflected the overhead lights back at you like a mirror. The rooms had windows facing the harbor, proper curtains instead of the plastic blinds on the lower floors, and a nursing staff that had been hand-selected by Director Victor Halstead himself. Quiet voices. Careful hands. No surprises. Elena Cross had been assigned there 6 weeks ago, transferred from the trauma unit downstairs after the previous wing supervisor, a woman named Diane Cho, had specifically requested her. Diane had worked with Elena for 2 years and knew what she was worth. She knew Elena could read a patient's vitals with a glance, could catch a medication error 3 steps ahead of the prescribing physician, and had the particular kind of stillness under pressure that most nurses spend an entire career trying to learn. What Diane had not anticipated was the way the VIP patients would react to Elena's face. The scars started at the left side of her collarbone and climbed. They moved up her neck in patterns that looked deliberate if you didn't know what fire did to skin. Tight, faintly ridged, pulling at the corner of her jaw in a way that made her expression always look slightly asymmetrical. In cold lighting, they looked severe. In the wrong mood, they could look frightening. Elena had long since stopped seeing them when she looked in the mirror. She saw her face. That was all. Other people saw something else. She had learned to manage that, a certain posture, direct eye contact that communicated competence before a word was spoken. Getting to the clinical information fast, before the patient had time to sit with whatever they were feeling about her appearance. Most of the time it worked. Most patients settled. The ones who didn't, she handed off to a colleague without making it a thing, documented it cleanly, moved on. She had been doing this for 11 years. She had figured out the system. Marcus Vane was not most patients. He was 53, post-cardiac stenting, 48 hours out from a procedure that had gone smoothly and required nothing more than careful monitoring and a medication schedule that a competent second-year nursing student could have managed. His net worth had been in the news enough times that even people who didn't follow finance knew the number. He owned 3 shipping conglomerates, a stake in a pharmaceutical distributor, and had donated enough money to Harborview Crest's endowment fund to have his name on the East Pavilion entrance. Elena had reviewed his chart before entering the room. She had done what she always did. Learned everything about the patient before she walked through the door, because patients aren't their diagnoses, but their diagnoses are a starting point. She noted his blood pressure trends, his current medication stack, the notation from the attending cardiologist about monitoring for a specific arrhythmia pattern that had appeared once during recovery and twice been unremarkable. She knocked, identified herself, and opened the door. Marcus Vane was sitting up in bed with a tablet in his lap, and the kind of restless energy that wealthy patients often had when they were confined to rooms and couldn't run anything. He looked up. His expression shifted in about half a second from mild annoyance to something that landed somewhere between disgust and confusion. "Who are you?" he said. "Elena Cross. I'm your nurse for this shift. I'm going to check your vitals and go over your medication schedule with you." He was still staring at her neck. She was used to that. She moved to the monitoring equipment and began pulling up his readings. "What happened to your face?" She didn't look away from the monitor. "How's your chest feeling today? Any tightness or pressure?" "I asked you a question, and I'm asking you one. Chest discomfort is something I need to assess first." She glanced at him. "Any pressure?" Vane set the tablet down slowly. I want a different nurse. I can request a colleague to take over if you have concerns about your care. Before I do, I want to make sure you're not experiencing any symptoms. I'm not having symptoms. I'm having a problem with whoever thought it was appropriate to send someone like you into a room like this. He gestured, a small wave that managed to encompass all of her. Do you know who I has donated to this hospital? Do you have any idea what this wing exists because of? Elena finished noting the blood pressure reading. It was elevated, probably situational, but she flagged it internally. I'm aware of your contributions to the hospital. I'm going to complete my assessment and then we can address any concerns you have about your care. I don't have concerns about my care. I have a concern about aesthetics. He said it like it was a reasonable word to use in that sentence. This is a private room. Patients in this wing are paying for a particular experience. You are not that experience. She had been spoken to this way before. Not often. People were usually a little more careful, a little less direct. But it had happened. She had a protocol for it. She kept her voice even and continued what she was doing. I'm going to listen to your heart now, she said, unclipping the stethoscope. Is this a joke? Vane's voice went up a register. He was looking at the scars on her hand as she reached toward him. Someone like you shouldn't be touching people like me. She stopped. Not because he'd surprised her, not because the words landed somewhere new. She stopped because there was a particular quality to his voice in that moment, carrying, certain, unashamed. And she was aware that it was loud enough to reach the hallway, and that there were 2 other nurses at the station outside the door, and that how she handled the next 30 seconds would be in someone's memory for a long time. She put the stethoscope back. I'll send my colleague to complete your assessment, she said. Have a good evening, Mr. Vane. She walked out. In the hallway, a nurse named Priya Anand was already looking at her with an expression that sat between sympathy and helplessness. Priya had been at Harborview Crest for 4 years and had the particular skill of looking completely unsurprised by things that were actually terrible. I heard, Priya said quietly. Can you take him? Already on my way. Priya touched her arm briefly as she passed, not pitying, just present, and went through the door. Elena went to the nursing station, pulled up her documentation terminal, and wrote a clean, factual note about the interaction. Patient requested care provider change. Colleague assigned. She did not write what he'd said. She wrote the outcome. That was how she had always done it. Keep the record clean, keep the emotion out of the chart. She was halfway through finishing her notation when her desk phone rang. It was the floor supervisor. Victor Halstead's assistant wanted her in the director's office at 9 the following morning. She had never been inside Halstead's office, but it looked exactly the way she'd imagined. Framed commendations on the wall, a desk wide enough to use as a dining table, a window looking down at the hospital's main entrance with an angle that let you watch everyone arriving and leaving. It was the office of a man who had decided that his function was administrative and had arranged his environment accordingly. Halstead was in his early 60s, trim, careful with his grooming. He had the manner of someone who had learned early that authority was about controlled expression and had been practicing it for 30 years. He didn't stand when Elena entered. He gestured to the chair across from his desk. There was another person in the room, a woman named Sandra Oren, who ran HR for the VIP wing. She had a folder in front of her and was not making eye contact. "Thank you for coming in," Halstead said, as though she'd had a choice. "Of course. I'll be straightforward. We've received a formal complaint from a patient in the VIP wing regarding last night's care interaction." He opened a folder of his own. "Mr. Vane has filed a written complaint stating that he was made uncomfortable by a nursing staff member's appearance and that when he requested a change of assignment, the staff member was, quote, resistant and dismissive." Elena kept her face still. "I offered to send a colleague to complete his assessment and then did exactly that. I wasn't resistant." He's characterizing the interaction differently. "I understand that." Halstead looked at her for a moment. Mr. Vane is a significant figure in this hospital's donor landscape. The East Pavilion, the cardiac monitoring equipment we received in the last fiscal year, the fellowship program in cardiology. Those are all tied to his contributions and to the relationships we maintain with donors of his profile. I understand that too. What I need from you, Halstead said, and his voice took on a tone that was rehearsed, probably the same tone he used when he was telling someone something unpleasant in language designed to sound reasonable, is a formal written apology to Mr. Vane, an acknowledgement that the interaction could have been handled more sensitively, and I'm going to ask you to take a brief reassignment to the general medical floor while we let this settle. There was a beat of quiet in the room. Elena said, "What specifically am I apologizing for?" "For the discomfort caused during the interaction." "His discomfort came from looking at my face. I'm being asked to apologize for my face." Halstead's expression didn't change. "I'm asking you to acknowledge that a patient in our care had a negative experience. Because of how I look, that's the reason." She wasn't raising her voice, she was being precise. "He told me directly that my appearance was the problem. He told me someone like me shouldn't be caring for someone like him. He was referring to my scars. I completed my assessment protocol as far as he would allow, sent a colleague to finish, and documented the outcome. There is nothing in my conduct that warrants an apology." Sandra Oren still hadn't looked up from her folder. Halstead folded his hands on the desk. "I understand this feels unfair. I'm not describing a feeling, I'm describing what happened. Nurse Cross." And now his voice dropped, the warmth completely gone from it. A bureaucratic efficiency underneath that had probably always been there. "The reality of this institution is that our ability to provide care to the patients we serve, all of them, depends on relationships and resources that require active maintenance. I am not in a position to prioritize one employee's personal comfort over the operational needs of this hospital." She looked at him steadily. "My personal comfort, that's what you're calling it. I'm asking you to consider the bigger picture. The bigger picture is that a patient insulted a nurse for a visible disability, filed a complaint misrepresenting the incident, and you are now asking that nurse to apologize for it. That's what's happening in this room." Something moved in his expression. Irritation, mostly, with something underneath it that might have been something closer to unease. He closed the folder. "The apology and the reassignment are not optional," he said. "If you're unwilling to comply, we'll need to discuss your continued placement in this facility." Elena sat with that for a moment, not because she was unsure, because she wanted the clarity of knowing exactly what was being said before she responded to it. "I won't apologize for the scars that saved lives," she said. The room was very quiet. Halstead looked at her the way people look at something they've decided has stopped being useful. "Then I'm going to need you to clean out your locker and return your badge to HR by end of shift today. Miss Oren will walk you through the paperwork." Elena stood. "I'll need documentation of the termination grounds." "You'll have it." She nodded once and walked out. "What?" The locker room on the VIP floor was small, 6 lockers and a bench. Elena sat on the bench for a moment after the door closed behind her, not because she was about to cry or needed to compose herself, but because the room was quiet and she had learned a long time ago to take quiet when it was available. Her locker held the things any nursing locker held: a spare set of scrubs, a water bottle, a small first aid kit she kept out of habit, a photograph of her and her sister Miriam taken 3 years ago at Miriam's kitchen table in Portland, both of them laughing at something off camera. She didn't remember what. She looked at the photograph longer than she meant to, then tucked it into her bag. She was pulling out the spare scrubs when Priya appeared in the doorway. "Word travels fast in this building," Elena said. "Halstead's assistant told 2 people, and Halstead's assistant tells everyone." Priya leaned against the doorframe, arms crossed. There was something careful in her face, the look of a person who wanted to say something strong and was editing it in real time. "This is wrong. What he's doing is wrong." "I know. Are you going to file something with the labor board, or I'll look into what options exist?" Elena folded the scrubs into the bag. That was honest. She didn't know yet. The options might amount to nothing, or they might take 2 years, and she didn't have 2 years of patience for bureaucratic process. She had patience for a lot of things. That particular kind had worn thin a while ago. "I'm okay, Priya." "You're allowed to not be." "I know that too." She finished clearing the locker and closed it. The metal made a hollow sound. She had her bag on her shoulder and was reaching for the door when the building's PA system activated, and then the overhead lights in the hallway shifted. A subtle change, almost imperceptible, the kind of thing you noticed only if you'd been in facilities that had emergency protocols. Then the lockdown alarm started. Not the general code that played when there was a fire drill or a behavioral incident on the psychiatric floor. This was a different tone entirely. Lower, more insistent, the kind of alarm that Elena's body registered before her mind caught up with it. She pushed open the locker room door and stepped into the hallway. The VIP floor had gone from its usual contained quiet to something else. Staff were at the windows at the end of the corridor. Someone's tablet had fallen off a cart, and nobody had picked it up. Two orderlies were standing in the middle of the hall, looking at each other like they were waiting for someone else to make sense of things first. Elena walked to the window. Below, in the hospital's main entrance drive, there were vehicles she hadn't expected to see at a civilian hospital. Black SUVs with government plates, the kind that didn't have markings because they didn't need them. Two of them had pulled up to the entrance. A third was angled across the emergency access lane. There were people moving from the vehicles toward the main doors. Not running, but moving with the specific efficiency of people who knew exactly where they were going and were not planning to be stopped. She counted them. She noted the posture, the gear, the way two of them split from the main group and positioned themselves at the corners of the entrance without being told. She had not seen those coordination patterns in 11 years. She felt something shift in her chest. Not fear, not quite. Something older than fear and quieter, something that recognized what it was looking at before the rest of her had caught up. Her phone buzzed. She looked at the screen. Unknown number. She almost didn't answer it. Then she did. Elena Cross, she said. A voice she didn't immediately recognize said, Captain Cross, please don't leave the building. The hallway noise was getting louder behind her. She could hear the elevator opening, voices, the sound of the stairwell door. She said nothing. We're coming to you, the voice said. Stay where you are. The call ended. Elena lowered the phone slowly. Below, one of the figures near the entrance looked up. It might have been coincidence. It might have been training. It might have been the angle of the light. And for a half second, she was looking directly at a face she had not seen since a burning mountainside in a country she was not supposed to have been in. The elevator at the end of the VIP hallway opened, and everything in Harborview Crest Military Medical Center stopped. The elevator doors opened and three men stepped out, and the VIP hallway, which had never in its carefully maintained history been anything other than hushed and controlled, became something else entirely. They weren't in uniform. That was the first thing. Civilian clothes, dark and unremarkable, the kind of clothes designed to communicate nothing. But they moved through the space with the particular economy of people who had spent years moving through spaces that were actively trying to kill them, and no amount of civilian clothing changed the way that looked to someone who knew what they were seeing. Elena knew what she was seeing. The one in front was in his late 40s, broad across the shoulders, with the kind of face that had been weathered by exposure rather than age. He had a scar of his own, a clean line running from his left ear toward his chin, the type left by shrapnel rather than surgery. She recognized him before he reached her. It took her brain a half-second longer to attach the name to the face because the last time she'd seen that face, it had been lit by firelight and he'd been bleeding through a field dressing she'd applied herself. Colonel David Resco. Retired, or at least that was what his LinkedIn had said when she'd looked, 3 years ago, for reasons she hadn't fully examined at the time. He stopped in front of her. Behind him, the two others had fanned out slightly. Not aggressively, but the way people do when they're trained to be aware of sight lines. Elena? Resco said. David. Her voice was even. She was grateful for that. You could have called. We did call. 5 minutes ago. Something moved at the corner of his mouth, not quite a smile. You know how it works. We move and we call at the same time. You were supposed to still be at your station. I was fired this morning. That landed. She watched him absorb it, watched the calculation move behind his eyes. Fired. Cleared out my locker, was on my way out when your vehicles pulled up. She glanced toward the window at the end of the hall. All 4 of them. 6, he said. 2 are in the parking structure. She filed that. What's happening, David? He looked at her for a long moment, and she could see him choosing what to give her and what to keep back, which was exactly what he'd always done, and which she'd never fully decided whether to find frustrating or reasonable. "Not here," he said. "We need a room." Whoa. The conference room on the VIP floor had been booked for a donor meeting that afternoon and was currently empty, chairs arranged around an oval table with a projector screen still deployed at one end from a previous presentation. Resco's two associates stationed themselves outside the door without being asked. Elena sat down. Resco didn't. "The secretary is in the building," he said. She processed that. "Which secretary?" "Defense." The room felt slightly smaller. "Jonathan Reeves," Resco continued. "He's downstairs with General Forsyth and two people from DARPA's medical division. They arrived 40 minutes ahead of us. We're the advance that was supposed to get here first, which tells you how the morning has gone on our end." He finally pulled out a chair and sat, but at the edge of it, the posture of someone who expected to stand again quickly. "There's an incident, active. I can't give you the full scope in this room." "Then give me what you can give me." "There are 11 people in a federal facility in Marengo County who need a very specific kind of help, and the two military surgeons we had on rotation are both unavailable in ways I'm not allowed to describe." Reeves went through the emergency medical roster, people with the right clearance, the right training, the right operational background. Your name was at the top. Elena was quiet for a moment. "My name's been inactive for 11 years. Your clearance is still current. That doesn't go away unless you apply to have it removed, and you never did." She hadn't. She wasn't sure why she'd never done that. She'd told herself it was because the paperwork was complicated, and that was partially true, but it wasn't the full answer. 11 people, she said. "What's the nature of the injuries?" "I can't. David, if you want me to say yes, I need something." He looked at her. "Blast injuries, some of them complex. At least 2 that are critical and have been staged at that facility for reasons related to the nature of the incident. Moving them to a civilian trauma center is not an option." She thought about that, about what blast injuries looked like when they'd been staged instead of treated, sitting in a facility without the right resources while people made decisions. She thought about the particular math of critical injuries and time. "Okay," she said. "Okay? I'll go." She said it before she'd fully decided, which was how she had made most of her important decisions. Her body had always been faster than her reasoning. "But I need 30 minutes. We have 20. Then I need 20. Resco studied her. He was not a man who easily showed uncertainty, but she could read the edges of it in him. "There's something else," he said. She waited. "The secretary wants to address the hospital, before we go. Something happened here that it's been brought to his attention, and he's—" Resco stopped, started again. "He's angry, Elena. I haven't seen him that angry in a while." She looked at her hands on the table. "What was brought to his attention?" "Your termination, the circumstances of it." He met her eyes. "Someone on this floor made a call this morning. I don't know who, but the information reached Reeves's office before we even landed." The VIP floor common area was not designed for gatherings. It had a seating arrangement intended for small family consultations, a coffee station, a window looking out at the harbor. It held maybe 30 people comfortably. There were 60 people in it now. Word had moved through the hospital the way it always did. Not through official channels, but through the faster, messier network of text messages and whispered questions and nurses finding other nurses in stairwells. The general medical floor had sent people up. The ER had sent 2 attending physicians who had heard something that made them decide their patients were stable enough to leave for 15 minutes. The administrative staff from the second floor had come in a cluster and were standing near the coffee station, looking uncertain about whether they belonged. Elena stood near the wall to the left of the doorway, slightly back from the main space. She had changed back into her work scrubs. She'd taken them out of the bag without thinking about it, and only after she'd put them on did she realize she'd done it. She was not sure what that meant. She was not sure what this next hour meant in general. Priya found her. "Are you going to tell me what's happening?" Priya said quietly. "I know about as much as you do." "Those are federal vehicles downstairs. There are people in this building who are carrying weapons under their jackets. One of them told Marcus Vane that he needed to stay in his room and that someone would come to speak with him shortly, and Vane actually stayed. Do you have any idea what it takes to make Marcus Vane comply with a direct request from someone he's never met? Elena almost smiled. I have some idea. Elena, she looked at Priya, her friend of 2 years, who had touched her arm in the hallway last night with the particular gentleness of someone who knew exactly how much was being carried and wasn't going to add to it. I'm okay, Elena said. I mean it this time. Priya didn't look fully convinced but let it go because the room was shifting. A wave of attention moving toward the doorway, people straightening, voices dropping. Jonathan Reeves walked in. He was younger than he looked in photographs, or maybe photographs just flattened something that was visible in person, a quality of focused energy, of someone whose presence arrived slightly ahead of him. He was in civilian clothes too, dark jacket over a collared shirt, no tie. General Forsyth was behind him, in uniform, which created a visual contrast that Elena suspected was not accidental. Reeves scanned the room. His eyes found Elena with a directness that meant someone had described exactly where she was standing. He didn't look away immediately. He held her gaze for 2 full seconds, acknowledging, assessing, something else she couldn't name, and then he looked at the room at large. I'll keep this short, he said. His voice carried without effort. I'm not here to give a speech. I'm here because I was informed this morning of an incident that occurred in this facility, and because I believe that certain things require a direct response from someone with the authority to give one. The room was completely silent. Even the coffee machine had been unplugged or turned off or something. There was no background hiss. A nurse in this wing was subjected to discriminatory treatment by a patient who objected to her physical appearance. When she handled that situation with professionalism and restraint, she was called before hospital administration and asked to apologize to the patient and accept a disciplinary reassignment. When she declined, she was terminated. He said it plainly, not dramatically. The plainness was the thing that made the room feel the way it felt. That nurse's name is Elena Cross. Most of you know her. Some of you have worked alongside her for years and know her to be competent and dedicated, which is the minimum of what she is. He paused. What most of you don't know is anything about who she was before she became your colleague, and that information has been classified. But I have the authority to change that, and as of this morning, I have. Elena was aware of every face in the room turning toward her. She kept her eyes on Reeves because that felt like the only anchor available. Captain Elena Cross served in the United States Army for 9 years as a combat trauma specialist attached to a special operations unit. She completed 4 deployments. During her final deployment, her unit was conducting a classified medical support operation when their transport was destroyed by enemy fire. Cross was the primary surviving medic. He stopped. Something moved in his expression. Not sentiment exactly, but something adjacent to it, the look of a person speaking about an event that has cost something. She returned to the burning wreckage of that aircraft. Twice. Under direct enemy fire. She extracted 4 wounded soldiers who would not have survived without immediate intervention. She sustained severe burns over 30% of her body during those extractions. She finished treating the wounds of 2 of those soldiers before she accepted treatment for her own injuries. The room was not just quiet. It was the particular quality of quiet that happens when a group of people are all holding their breath at the same time. The scars that this patient found objectionable, Reeves said. And now there was something harder in his voice, a precise anger, carefully controlled, are the direct result of that action. Captain Cross received the Distinguished Service Cross for what she did on that mountain. It is this nation's 2nd highest military decoration. She has been carrying that quietly for 11 years while building a second career as a nurse, a career in which, by every documented measure, she has been exceptional. Victor Halstead was standing near the back of the room. Elena could see him from where she was. His face had done something complicated. A sequence of expressions moving through it that she couldn't fully track. He looked smaller than he had that morning. The termination issued this morning is rescinded, Reeves said. Effective immediately. That is not a request to hospital administration. That is a directive from the Department of Defense, and the legal basis for that directive has already been communicated to your board of directors in writing. He turned then and looked directly at Elena, not performing it, just looking at her. Captain Cross, he said, I'm sorry it took this long to say this in a room where people could hear it. She didn't say anything. She wasn't sure she could have. Somewhere near the coffee station, someone started clapping. It spread through the room unevenly, the way real applause does. Not a performance, not choreographed, different people arriving at it at different speeds. Elena looked at the floor for a moment. She pressed her thumbnail into her palm, not hard, just enough to feel something specific and grounded. It was a thing she'd done since she was 12 years old when she needed to stay inside herself. When she looked up, Priya was watching her with an expression Elena didn't have a word for in English. She thought there might be a word for it in another language, something about witnessing. Then she saw Marcus Vane. He was standing in the hallway beyond the open doorway. He'd either been there for some time or had arrived midway through. She couldn't tell. He was in his hospital gown, which made him look unexpectedly diminished, all the gravity of his usual presentation stripped away by the thin fabric and the IV line still attached to his left forearm. He was watching Reeves. His face was doing nothing at all, which was its own kind of expression. Reeves had seen him too. Forsyth leaned toward Reeves and said something quietly, and Reeves gave a single nod in return. He walked to the doorway. He looked at Vane for a long moment, and Vane looked back, and the hallway between them might as well have been a mile. "Mr. Vane," Reeves said, "someone will be in to speak with you shortly about the formal complaint you filed. I'd encourage you to think carefully about how you'd like that conversation to go." Vane's jaw moved. He didn't speak. Reeves turned back to the room. Elena was watching Vane's face when the next thing happened, which is why she saw his expression shift from defended blankness to something she recognized as the specific look of a man who has realized that a situation has turned in a direction he cannot reverse. His hand went to the IV port on his forearm. A monitoring alarm sounded from his room, faint from here, but present. Then he swayed. Priya saw it at the same moment Elena did. They were both moving before they'd consciously decided to, the nursing reflex faster than any thought, and Elena was through the doorway and reaching Vane as his knees buckled, catching his arm, taking his weight. He was heavy. She hadn't expected that. He was taller than he looked in the bed, and his body had the density of a man who had been physically substantial once and hadn't entirely lost it. She took his weight with both arms, and it pulled at the scarring along her left shoulder in a way that always made itself known. "I've got him," she said. "Priya, crash cart status, get his monitor readings. On it." She lowered Vane to the floor, not gently, not roughly, practically, and checked his pulse. It was there, irregular and fast. His color was wrong. His eyes were open and tracking, but dull. The monitoring alarm from his room was still sounding. Around them, the crowd had cleared back without being asked. Some vestigial survival instinct creating space. Reeves had stepped back. Forsyth was watching without expression. Elena was already working. She was checking Vane's airway, her fingers moving through the assessment with the automatic precision of 11 years of clinical muscle memory, and the part of her brain that was running the medical calculation was entirely separate from the part of her brain that was registering the particular strangeness of being on her knees in a hospital hallway, keeping alive the man who had called her a monster 12 hours ago. "His BP's dropping," Priya said from beside her, the portable monitor in hand. "What was his last arrhythmia reading?" 1,400 hours sinus with occasional PVCs. Elena pressed 2 fingers to his neck. The pulse under her fingertips was doing something that matched nothing good. "Get Dr. Okafor, now, and get me a 12 lead." She stayed on the floor beside Marcus Vane, whose empire and whose cruelty and whose careful assessment of her worth had all collapsed into this single undignified moment on a linoleum hallway, and she worked. Because that was what she did. That was what she had always done. She did not look up when she heard Reeves say something to Forsyth in a low voice behind her. She did not look up when 2 nurses came running with equipment. She was aware peripherally of Resco appearing in the hallway at some point, taking in the scene, and then very deliberately not interfering. What she did not know, what none of them knew yet, was that the monitoring equipment in Vane's room had captured something in the last 4 minutes of data that the cardiologist on call, Dr. Felix Okafor, would look at 6 minutes from now and go very still over. And what Okafor would say quietly to the attending physician standing next to him was, if she hadn't caught him when she did, he'd be coding on that floor right now. Vane's pulse steadied slightly under Elena's fingers. Not much. Enough. She kept working. Dr. Felix Okafor was not a man who panicked easily. He had been a cardiologist for 19 years, had run codes in stairwells and parking lots, and once, memorably, in the back of a catering van during a hospital fundraising event. And he had developed the particular professional stillness that came from having seen enough emergencies to know that panic was a resource expenditure with no return. But when he looked at the 12-lead readout from Marcus Vane's portable monitor, and then at the rhythm strip Priya handed him from the room's bedside unit, he went quiet in a way that made the attending physician next to him stop talking mid-sentence. "When did this pattern start?" Okafor said. "The strip show's onset approximately 18 minutes ago," Priya said. "He was ambulatory when it began, walking in the hallway." Okafor looked up from the paper. Elena was still on the floor beside Vane, one hand maintaining pressure on the IV site where the line had partially dislodged when he went down. She had controlled the immediate situation with the efficiency of someone who didn't need to think about the steps. She just did them. And now she was holding the stability she'd bought while the physician caught up. "Vitak?" Okafor said, not to anyone specifically, looking at the strip. "Borderline," Elena said without looking up. "His rate was 140 when I caught him. Dropped to 122 in the last 2 minutes. He's conscious and maintaining pressure, but it's soft." Okafor crouched down on the other side of Vane. He did his own pulse check, looked at the monitor Priya was holding, and made the decision in about 4 seconds. "Get him back to the room. I want continuous monitoring, crash cart at bedside, and get anesthesia on the phone. Not paging, phone, right now." They moved Vane on a gurney that materialized from somewhere down the hall, which was how emergency equipment always appeared in hospitals, suddenly, from the edges, pulled into existence by the momentum of a crisis. Elena walked alongside, keeping her hand on the IV site, monitoring his color, talking to him in the low, practical voice she used with patients who were frightened and didn't want to show it. "You're still with me," she said. Vane looked at her. His face was the color of old concrete. He was frightened, so she could see it clearly now, all the careful architecture of his usual presentation completely stripped. He was just a man on a gurney with his heart doing something wrong inside his chest, and all of his money and his influence and his opinion of her face were nowhere in this moment. "Am I dying?" he said. His voice was thinner than she'd heard it. "Not right now," she said, which was honest. She didn't dress it up. Something moved in his expression. That's not reassuring. It's what I've got." She checked his pulse again. "Keep breathing slowly. Don't try to talk." He closed his eyes. She kept walking alongside the gurney. They stabilized him in 18 minutes. Okafor used synchronized cardioversion after the second attempt at pharmacological conversion failed. The electric shock carefully calibrated, the team working in the compressed rhythm of practiced emergency response, each person knowing their piece without narration. Elena was at the medication draw when Okafor called for it, had the right dose prepared before he finished the sentence, and he took it from her without comment, which in an emergency room context was the highest form of acknowledgement. The rhythm converted. Sinus. Not clean. There were still irregularities in the strip that Okafor would spend the next hour analyzing, but Vane's color came back, his pressure stabilized, and the particular quality of the room shifted from controlled urgency to controlled watchfulness. Elena stepped back from the bedside. Her left shoulder was burning along the scar tissue from the weight she'd taken in the hallway. She rotated it slightly, working against the stiffness, and became aware that her hands were shaking very slightly. Not from fear, but from the adrenaline clearing her system, the normal biological aftermath of sustained emergency focus. She pressed her thumbnail into her palm, steadied. Okafor found her in the doorway. "You caught the arrhythmia before he collapsed. I felt it in his pulse when I was doing the initial check." He looked at her for a moment with the evaluative expression of a physician assessing another clinical professional. "You didn't hesitate when he went down." "No. The man had you fired this morning." "I'm aware of that." Okafor considered this, then nodded once, slowly, the nod of someone filing information in a place they'd return to later. He went back to his patient, Elena walked out of the room. Resko was in the hallway, where he had been for the last 20 minutes. He fell into step beside her without preamble. "We're pushing the departure window," he said. "I know. Give me 5 minutes." "Elena?" "5 minutes, David." He let her have them. She went to the locker room, which was empty now, and sat on the bench again. The same bench from this morning, which felt like a different day. She sat with her hands on her knees and breathed through the shoulder pain and the adrenaline and the accumulated weight of the last 14 hours. And she gave herself exactly 4 of the 5 minutes to feel all of it. The humiliation of Halstead's office, the particular sting of being assessed by the man in the bed and found lacking, the strange and disorienting experience of having her history spoken aloud in a room full of people she'd worked alongside for months, while keeping it entirely to herself. She was not angry. That surprised her a little. She had expected anger. What she felt instead was something heavier and harder to name, a kind of tired recognition, the feeling of a person who has been carrying something for so long that they've built their posture around it, and now someone has lifted it, and the relief and the ache exist in exactly the same place. On the 5th minute, she stood up, pulled her hair back, and walked out. The federal facility in Marengo County was 40 minutes by air and another 12 by vehicle, and Elena spent the flight time reviewing the medical briefing Resko handed her on a secured tablet. Injuries, patient profiles, the current clinical status of each of the 11 people she was going to, the 2 critical cases flagged at the top of the list. She read it with the focused speed of someone who had done this before, absorbing the clinical data, building the triage map in her head, flagging the complications, noting the resource constraints. Beside her, Resko watched her read without speaking. After 20 minutes, he said, "You still think the same way." "What way?" "You go quiet. Your eyes stop moving across the page and you're just processing." She kept reading. "You've been watching me read for 20 minutes?" "I've been watching you work for 20 minutes. It's not the same thing." She turned a page. "Who's managing the supply situation on site?" The notes reference a shortage in blood product availability. "Agent Navarro is coordinating with the civilian hospital in Whitmore County for supplemental supply. It's been arranged but not confirmed." "That's a problem." "We know. Not confirmed blood product for 2 critical blast injuries is not a contingency plan, David. It's an optimistic guess." "I know that too." His voice didn't have apology in it, which she appreciated. He wasn't pretending the situation was better than it was. That's partly why Reeves went to the roster directly, instead of going through standard channels. Standard channels would have taken 6 hours we don't have. She filed that and kept reading. The transport noise made conversation difficult beyond a certain level of effort, which suited her. She needed to be inside the clinical picture before they landed, needed to have already made the preliminary decisions so that when she walked into that facility, she could move immediately rather than assess from the beginning. The 2 critical cases were a man named Sergeant First Class Dario Tate, 31, blast fragmentation injuries to the abdomen and left leg, currently stabilized but deteriorating on a timeline that the notes described as hours, not days, and a woman named Specialist Renata Voss, 26, traumatic brain injury compounded by shrapnel to the upper chest, sedated, GCS of 9 at last assessment. Elena read Voss's profile twice. Something in the pattern of injuries and the notation about sedation management struck her as misaligned. The dosing described in the notes was standard protocol, but given the TBI component, standard protocol was the wrong choice. It would be suppressing the neurological indicators she needed to track. She made a note on the tablet. She made 4 more notes before they landed. The facility was not what she'd expected, which was itself an expected experience. Classified locations rarely looked like what the word facility implied. It was a converted agricultural processing building set back from a gravel access road, the kind of structure that was unremarkable from the air and invisible from the road, and had been that way by design for longer than the current operation had been running. Inside, it was efficient in the way that emergency field operations were efficient. Not comfortable, not well-resourced, but functional, organized by people who knew what mattered and had arranged things accordingly. There were 8 personnel on site, plus the medical support team that had been working the 2 critical patients. The lead medic, a woman named Corporal Sasha Penn, met Elena at the interior entrance with the brisk handoff manner of someone who had been waiting for reinforcement and was ready to hand the burden to capable hands. Tate's pressure has been trending down for the last 40 minutes, Penn said, walking with Elena toward the back of the building. We've been managing with what we have, but the abdominal situation needs intervention that's beyond our setup. What's your IV access? 2 large bore peripheral lines, left arm. Central access kit is on site, but I haven't been able to. There were other priorities. Okay. Elena was already pulling on gloves from the supply table Penn indicated. What's his urine output? Decreased over the last 2 hours. Foley's in. Blood product status? Penn's expression flickered. Just for a second. The look of someone delivering news they know is bad. We have 2 units packed red cells on site. Navarro is working the Whitmore situation, but it's not confirmed, Elena said. Not confirmed. Elena stepped into the room where Tate was and assessed him in the first 15 seconds, the way she'd assessed patients for 11 years. Global picture first, immediate threats ranked, intervention sequenced before she reached the bedside. He was conscious, which was something. His color was the particular gray of compensated shock, the body still fighting, still maintaining pressure through vasoconstriction, but fighting on borrowed time. I'm Elena Cross, she said, because patients needed to know who was working on them. I'm going to take a look at everything, and then we're going to deal with what needs dealing with, okay? Tate looked at her with the dark, alert eyes of someone in significant pain who was managing it by concentrating intensely on everything around him. He was young, 31, the file said, but looking at his face, she thought he looked both younger and much older than that at the same time. You the specialist they sent? He said. That's me. Are you actually going to be able to help, or is this another... Sorry, That came out wrong. No, it didn't, she said, already palpating his abdomen, watching his face for the response. You've been waiting for someone to show up and actually do something. That's not a rude question. He hissed through his teeth at the palpation pressure. There, deep left quadrant, the guardian she expected. Yeah, he managed. I'm going to do something, she said. Not a promise, a statement of fact. She spent 12 minutes with Tate, building the intervention plan in her head, then moved to Voss. Voss was sedated, as the notes indicated, and it took Elena approximately 3 minutes of chart review and direct assessment to confirm what she'd suspected on the transport. The sedation protocol was suppressing exactly the neurological response indicators she needed. She adjusted the dosing, a specific calculated reduction that she explained to Penn in the clipped, precise language of someone who needed the medic to understand and implement correctly. If she starts showing purposeful movement or tracking, I need to know immediately, Elena said. Understood. And get Navarro on the phone. The blood product situation needs a resolution in the next 30 minutes, not the next 3 hours. Penn nodded and moved. Elena went back to Tate. The next 40 minutes were the kind of sustained clinical work that required everything she had. Not dramatic, not cinematic in the way people imagine medical emergencies from the outside, but grinding and precise and relentless. The constant management of a system that was trying to fail while she tried to prevent it. She started the central line herself when it became clear that Penn had her hands full with Voss's adjusted sedation response. She managed the second unit of packed cells against Tate's pressure readings, calculating the rate against his output, watching the numbers, adjusting. Resco appeared in the doorway twice. She didn't look up either time. He didn't speak. The blood product confirmation from Whitmore came through at the 43-minute mark. 6 units en route, ETA 22 minutes. Elena heard Penn relay the information and felt something in her chest loosen by 1 degree. Tate's pressure began to stabilize at the 50-minute mark. Not dramatically. A few points of systolic, the trend reversing, the gray in his face not gone but stationary. She watched it for 7 minutes before she let herself believe it was real. You still with me, Sergeant? She said. Still here. His voice was rough but present. Good. Try to stay that way. I'm working on it. A pause. Your hands are shaking a little. Adrenaline clearance, she said. It's normal. Does it bother you? That they shake? She looked at him directly. He wasn't asking to be difficult. He was asking the way exhausted, frightened people sometimes ask things, from a place of needing to talk about something that wasn't their own pain for 30 seconds. "Used to," she said. "Not anymore." She went back to managing his line. At the 58th minute, Resco came into the room for the third time, and this time he spoke. "Elena." She looked up. His face was doing something she hadn't seen it do in 11 years. Something that wasn't quite controlled, wasn't quite the David Resco she knew. "What?" she said. "There's a development at the hospital." He glanced at Tate, then back at her. "Halstead." She waited. "He contacted Vane's private legal team 40 minutes ago. We had a monitor on his communications. Standard protocol given the DOD directive issued this morning." Resco stepped closer, lowering his voice below what Tate could track. "He's been working this since before we left, Elena. The apology, the termination, the complaint Vane filed, Halstead coached it. He told Vane what to write. There are messages." She looked at him. "How many people know?" "Right now? Forsyth, 2 people in Reeves's office, and me." He met her eyes. "And you?" The room was very quiet except for the slow beeping of Tate's monitor and the distant sound of a vehicle on the gravel road outside. "There's more," Resco said. She waited again. "Vane's legal team sent a response to Halstead 20 minutes ago. They're not protecting him. Resco stopped, chose the word. "They're separating." Elena processed this. Vane's team, who Halstead had apparently assumed would close ranks behind the mutual story, had instead looked at the legal exposure created by the DOD directive and the documented messages and made the calculation that wealthy, legally sophisticated people always made when the numbers turned against them. They were leaving Halstead alone with it. "Where's Halstead now?" she said. "Still in the building. Reeves left Forsyth behind specifically to ensure that." Resco's jaw was tight. "But there's a problem. Halstead's been on the phone with the hospital's board chair for the last 30 minutes. He's trying to frame the termination as a standard administrative decision made in good faith. If the board accepts that framing before Reeves gets back and presents the documented evidence, they might close around him," Elena said. "Protect the institution. It's happened before." She turned back to Tate's monitor, checked the rate, checked his pressure, ran the numbers in her head. Then she said, "How long until Reeves is back at the hospital?" "He's finishing a briefing at Langley, 3 hours minimum." 3 hours was enough time for a hospital board to circle its wagons, take legal advice, and construct a version of events that could survive scrutiny if the scrutiny came slowly enough. She knew how institutions worked. She had spent 11 years inside them. She knew that the speed of justice and the speed of institutional self-protection were not the same speed, and that the gap between them was where most accountability went to disappear. Tate's monitor beeped. She looked at it, and then her own secured phone, the one Resco had handed her on the transport, the one connected to Reeves' communications network, lit up with a message that she read once, then read again. It was from an address she didn't recognize, routed through the secure network, and it contained 3 sentences and a file attachment. The first sentence said, "My name is Sandra Oren. I work in HR at Harborview Crest." The second sentence said, "I have been documenting what Victor Halstead has done to staff members in this hospital for 4 years." The third sentence said, "I didn't look up from my folder this morning because I was ashamed. I am not ashamed anymore." Elena stared at the phone. The file attachment was 847 pages long. Elena forwarded the message and the attachment to Resco without a word and watched him read it on his own device. She watched his face move through the information the same way her own face probably had. The particular sequence of a person absorbing something that recontextualizes what they thought they already understood. He looked up. 4 years. That's what she says. 847 pages. I can count. He was quiet for a moment. Outside the room, she could hear pen moving, could hear the distant sound of the Whitmore blood product delivery arriving at the exterior entrance, voices coordinating in the efficient shorthand of people managing logistics under pressure. Tate's monitor continued its slow, steadied beeping. Reeves needs to see this before he goes into any conversation with the board, Resco said. I know. I'm going to forward it directly to his secured line. Do that. She looked at her phone again, at the name at the top of the message. Sandra Oren, who had sat across from Elena in Halstead's office that morning with a folder in front of her and her eyes on the table. Who had not looked up. Who had spent the morning after that composing a message on a secured government channel to a woman she barely knew, attaching 4 years of her own professional risk to it and pressing send. Elena did not know what combination of things had moved Sandra Oren to that decision: the morning's events, Reeves's speech, something older and more private than either of those, and she did not need to know. She only knew that the woman had chosen to stop being quiet, and that the timing of that choice mattered in ways that Sandra Oren herself might not fully understand yet. Tell Reeves she needs protection, Elena said. Resco looked at her. Halstead's not... I don't mean physical protection. I mean institutional protection. If she's been documenting for 4 years and Halstead finds out she's the source, he'll move to discredit her. He'll go through her HR file. He'll find every performance notation that can be read negatively. And he'll build a counter-narrative before the ink dries on any official complaint. She looked at him steadily. Make sure Reeves knows to get her statement formalized and witnessed before Halstead knows it exists. Resco held her gaze for a moment, then nodded. You should have gone into law. I like keeping people alive better, she said, and went back to Tate. She stayed at the facility for another 2 hours and 14 minutes. Tate's pressure continued its cautious improvement through the first hour, and by the 90-minute mark she was willing to say with something approaching confidence that the critical window had moved. Not closed, he needed surgical intervention that the facility couldn't provide, and the logistics of moving him safely to a proper operating environment were going to require another set of decisions she wasn't going to be part of. But the immediate crisis had been managed, the trajectory had changed, and that was what she'd been sent to do. Voss was more complicated. The adjusted sedation protocol had revealed what Elena suspected: purposeful movement in the left hand, eye tracking that was absent in the earlier assessment, indicators of neurological activity that the oversedation had been masking. It didn't resolve the TBI. Nothing Elena could do in a converted agricultural building was going to resolve a traumatic brain injury. But it gave the medical team information they hadn't had before, changed the picture in ways that mattered for the decisions ahead. Penn gave her a look at the end of the shift handover that was difficult to interpret, something between gratitude and the particular exhaustion of someone who has been holding a situation together by force of will and is now being allowed to let some of that effort down. You should sleep, Elena told her. I'll sleep when the transport situation is confirmed, Penn said. That's what everyone says. And then they sleep when the transport situation is confirmed. Elena almost smiled. Fair enough. She found Resco in the outer room, phone to his ear, the compressed posture of someone receiving information they were processing in real time. He held up a finger when he saw her. Wait. And she waited, reading his face for the shape of what he was hearing. He lowered the phone. Reeves is back at the hospital. How long ago? 20 minutes. He moved the Langley briefing. Something in Resco's expression shifted, settled. He read Oren's file on the transport. She absorbed that. Reeves, who had already been angry that morning, reading 847 pages of documented abuse of institutional authority over a 40-minute flight. She thought about what that would do to a person who already had the disposition and the power to act on it. Is Halstead still in the building? She said. He was, as of 30 minutes ago. He's been in a closed meeting with the board chair and the hospital's legal counsel. Resco paused. Forsyth's been outside that room since it started. Elena picked up her bag from the floor beside the supply table where she'd set it when she arrived. She checked her watch. She looked at the door. Take me back, she said. The helicopter descended toward Harborview Crest as the late afternoon light hit the harbor at the angle that made the water look like hammered metal, flat and bright and hard-edged. Elena watched it through the window and thought about nothing specific. A deliberate mental practice she'd learned a long time ago, the discipline of emptying before walking into something that required full presence. You couldn't be full of the last thing when you needed to be present for the next thing. She'd learned that the hard way, in a different context, and the lesson had transferred. The hospital's main entrance had a different quality to it when they arrived. The federal vehicles were still present, some of them, but the atmosphere had shifted from the contained emergency of the morning to something that was harder to read. People were moving with more purpose than usual. The administrative staff on the ground floor were not at their stations in the normal way. The energy of the building had been disturbed, the way the energy of any environment is disturbed when something significant is happening inside it that most of the people present don't fully understand. General Forsyth met them in the lobby. He was a man of about 60 who had the permanent posture of someone who had spent 4 decades being the most prepared person in any room, and he looked at Elena with the direct assessment of a superior officer evaluating a subordinate whose performance report he had just finished reading. "Captain Cross," he said. He did not preface it. No formerly or retired. Just the rank, cleanly applied. "General?" "The secretary is with the board. He'll want you present." He turned and walked, and they fell in behind him, the efficient choreography of people moving toward something that needed to be finished. "Where's Halstead?" Resco said, quiet enough for Forsyth's ears only. "Still in the meeting. He doesn't know Oren's file has been received." Forsyth's voice was completely even. He's been attempting to manage the board's understanding of events using the version of the story he constructed this morning. The board chair is a pause that communicated volumes without stating any of them. Receptive to the institutional argument. "Meaning he's inclined to protect the hospital," Elena said. "Meaning he's inclined to protect the board's liability exposure, which in his mind is the same thing." Forsyth glanced at her. "The secretary has a different view." The board meeting room was on the 4th floor, a space that managed to communicate both authority and the particular blandness of rooms designed for institutional decision-making. A long table, identical chairs, framed photographs of past board members on the wall, the slight staleness of recycled air. When Forsyth opened the door, Elena counted 7 board members, the board chair, a man named Gerald Foss, mid-60s, the practiced composure of a longtime institutional operator, the hospital's legal counsel, and Jonathan Reeves. Halstead was at the far end of the table. He saw Elena come through the door, and something happened in his face that he controlled within a second, but not fast enough. Reeves was standing. He had been standing before they entered, and he remained standing. A choice, Elena registered, that established something about the nature of the room without requiring any commentary on it. "I asked Captain Cross to join us," Reeves said, "because what I'm about to present to this board is directly relevant to her, and because I believe she has the right to be in the room when it's presented." Foss looked at Elena with the cautious expression of a man recalibrating. He had been managing a board conversation about an employment dispute involving a nursing staff member. The nursing staff member had just walked in with a Secretary of Defense and a 2-star general. "Of course," Foss said, with the careful neutrality of a person who has decided that neutrality is the only safe position available. Reeves set a tablet on the table and turned it so the board could see the display. "This morning, I received documentation from a member of this hospital's HR staff. The documentation covers a period of 4 years and details a pattern of conduct by Director Halstead involving the systematic manipulation of staff complaint and disciplinary processes to protect high-value donor relationships at the expense of staff welfare and, in several cases, patient safety." The room was very still. Halstead was the stillest thing in it. "I want to be precise about what this documentation shows," Reeves continued, "because I want there to be no ambiguity in this room about what occurred." He touched the tablet. "Director Halstead did not make an independent administrative decision this morning to terminate Nurse Cross following a patient complaint. He coached the complaint. He told Mr. Vane what language to use. He had a draft of the formal complaint in his email outbox 11 minutes before Mr. Vane submitted it through the patient services portal." He looked at Foss. "Those are not allegations. Those are documented communications recovered from Director Halstead's institutional email account, which is hospital property and carries no expectation of privacy under the employee agreement each staff member signs upon engagement." Legal counsel started to say something. Reeves looked at him and he stopped. There are also 14 prior incidents documented in the material I received this morning. 14 cases over 4 years in which staff members, 12 of them women, 10 of them from demographic groups that Harborview Crest's own diversity reports identify as underrepresented in senior roles, were subjected to complaint processes, disciplinary reviews, or terminations that Director Halstead initiated or influenced to manage the comfort of major donors. He paused. He let the silence do work. 3 of those staff members filed external complaints with the State Medical Labor Board. 2 of those complaints were dismissed after this hospital's legal counsel provided documentation. Documentation, I want to be clear, that was sourced through Director Halstead, characterizing the complainants as having performance issues that predated the relevant incidents. Foss's carefully maintained neutrality was developing cracks. Not dramatic ones. He was too experienced for that. But Elena could see them. The way his hands had changed position on the table. The way he was no longer looking at Halstead at all. One of the board members, a woman in her 50s who Elena didn't know, hadn't seen in the building before today, said quietly, "Gerald, we need to—" "I know," Foss said. He said it without looking away from Reeves. Halstead had been silent since they entered. He was still silent. Elena watched him and saw a man doing a very specific kind of calculation, not the calculation of someone deciding whether to fight, but the calculation of someone counting what resources remained and finding fewer than they'd expected. She had seen that particular internal accounting before, in different circumstances, and it always looked the same, smaller than the person had been before. Reeves turned from the board and looked at Halstead directly for the first time since Elena had entered the room. It was a brief look, not cruel, not performative, just clear. "Mr. Halstead," he said, "the Department of Defense is referring this matter to the State Attorney General's office and the Federal Labor Board. That referral has already been submitted. It went in 40 minutes ago." He picked up the tablet. "I'm telling you this now because I believe you should know the timeline. Not as a courtesy, because I want you to understand that the decisions made in this room in the next hour will occur with full knowledge of that referral." Halstead looked at the table. "Is there something you'd like to say?" Reeves asked. A long moment. The ventilation system made a faint sound. Someone's chair moved slightly. "I'd like to speak with legal counsel," Halstead said. His voice was level, which Elena suspected cost him something. "You can do that outside this room," Reeves said. "You're not currently under detention, and no one here is preventing you from doing anything. But I'd encourage you to understand that the documentation in question is already in the hands of 3 separate oversight bodies, and the question of legal counsel is separate from the question of what this board decides to do in the next hour about the leadership of this institution." Halstead pushed back his chair. He stood. He was careful about it. The precise, controlled movement of a man who understood that how he left a room was a kind of statement. And he walked to the door without looking at Elena. He reached the door. His hand was on the handle. He stopped. Elena didn't know what made him stop. Something he was going to say, maybe, that he thought better of. Some impulse toward explanation or justification that the remaining functioning part of his judgment overrode. He opened the door and walked out. Forsyth, who had been standing near the wall, made a small signal to someone in the hallway. Elena didn't see who. She heard footsteps following Halstead down the corridor at a distance. Not arresting, not confronting, just present. The board meeting continued for another 40 minutes without Halstead in the room, and Elena sat through it with the particular detachment of someone who is present but not central to the procedural machinery turning around them. Reeves presented the remaining elements of the Oren documentation with the methodical patience of a man who had spent 30 years in environments where the difference between an argument and a winning argument was specificity and sequencing. Foss asked questions. They were good questions, actually. Elena revised her assessment of him upward slightly during that portion, because a man genuinely trying to protect liability would ask easier questions, more deniable ones. Foss was trying to understand. That was different. The board member who had spoken earlier, Elena learned her name was Dr. Constance Yee, a retired cardiothoracic surgeon and the board's longest-serving member, asked the most pointed questions of anyone. She asked about the 3 prior complainants whose external cases had been dismissed. She asked about the documentation used against them. She asked, with precise and careful language, whether the hospital's legal counsel had reviewed the Oren file in its entirety. Legal counsel said he had not had the opportunity. Yi looked at him for a moment with the expression of a surgeon examining something that needed to be removed. "You'll want to do that," she said, and turned back to Reeves. At the end of the meeting, Voss requested a 48-hour recess to allow the board to review the documentation before taking formal action. Reeves agreed to the recess. He made clear, briefly and without elaboration, that the federal referral was not contingent on the board's timeline, and that the existence of the recess did not change the nature of the oversight bodies now examining the matter. When the room cleared, Reeves found Elena near the window. The harbor light had changed in the hours since she'd arrived. Lower now, the water darker, the city's edge sharper against the sky. "Tate and Voss?" he asked. "Tate is stabilized. He needs surgery. Voss, the neurological picture is better than the morning assessment suggested. She needs time." She looked at him. Penn is capable. She was managing a difficult situation with inadequate resources. "I'll make sure that's noted." More than noted would be better. He acknowledged that with a slight nod. They stood for a moment in the residual quiet of the room, the particular quiet after a long and weighted day when the immediate urgencies have passed, and what remains is the future, which is always harder to hold. "Oren," Elena said. "Sandra Oren needs—" "She's been contacted. We have a formal statement being recorded now with 2 witnesses and a federal labor advocate present." He looked at Elena. "She asked if you'd been told it was her." "I was told. She wanted you to know that she watched you walk out of Halstead's office this morning, and she made the decision in that moment." He paused. "She said she'd been close to it for a while, but watching you refuse to apologize for something that wasn't wrong, that was the thing." Elena looked at the harbor. She didn't say anything for a moment. "I didn't do it to inspire anyone," she said finally. "I did it because I was tired and because I'd run out of patience for apologizing for things I didn't do." "I know," Reeves said. "That's usually how it works." He left a few minutes later, and Elena remained at the window. Outside, she could see one of the federal vehicles, still in the entrance drive. She could see hospital staff moving in and out of the main entrance, the end-of-shift changeover, the ordinary machinery of the institution continuing to turn regardless of what had happened inside it today. Her phone buzzed. A message from Priya. "Where are you? There's something happening downstairs you need to see." Elena looked at the message. She was tired, not the simple tiredness of a long day, but the specific deep tiredness of a day that had required everything she had in several directions at once. Her shoulder was still burning. She was aware of the photograph of herself and Miriam that was still in her bag. She typed back, "On my way." She picked up her bag and walked to the door. In the lobby, she could hear noise. Not an emergency, not the compressed tension of this morning, something different. She came down the stairwell and stepped into the main lobby and stopped. There were people everywhere. Not the contained, purposeful movement of a functioning medical facility, but something looser and more human. Staff from multiple floors, some in scrubs, some in the civilian clothes of people who'd come back after their shifts ended or hadn't left when they should have. Priya was near the main desk. Dr. Okafor was there. Several nurses Elena recognized from the general medical floor. 2 of the attending physicians she knew only by sight, and at the center of the lobby, being walked through the main entrance by 2 men Elena now recognized from Forsyth's team, with his legal counsel slightly behind and to the left, was Victor Halstead. He was not in handcuffs. She noted that immediately. This was not an arrest. The referral was in process, not executed, and the distinction mattered. But the 2 men walking with him were not escorts in the social sense. They had the unmistakable quality of custody without the formal designation, and everyone in that lobby understood the difference between a man leaving his office and a man being walked out of his institution. Halstead saw the lobby. He had not, Elena suspected, anticipated this. He'd expected a side exit, a quiet departure, the kind of managed transition that institutions arranged when they needed to separate from someone quickly and without spectacle. Instead, the lobby was full of people who had spent the day processing what had happened to a colleague they'd worked alongside for 2 years, and who were now watching the person responsible for it leave the building. Nobody moved, nobody spoke. It was not a protest, it was not a demonstration. It was simply people being present, which was sometimes the most powerful thing available. Halstead walked through it with his eyes forward. He was good at this, at maintaining the surface, at giving nothing away through expression or movement. Elena watched him and saw all of that skill deployed in real time. The practiced composure of a man who had spent years controlling rooms, now being used simply to cross a lobby. He passed within 20 feet of where Elena was standing. For a moment, a brief, involuntary moment, his eyes found her. She looked back at him. She didn't say anything. Neither did he. Then he was passed, through the main doors, and the lobby noise resumed. Voices, movement, the ordinary sounds of a building returning to itself. Priya appeared at Elena's shoulder. "How are you doing?" "I don't know yet," Elena said honestly. "That seems fair." Priya was quiet for a moment. "Okafor wants to talk to you when you have a minute. About Vane." Elena turned. "His condition?" "He's stable. Okafor says he'll be fine, medically." Priya chose her next words with the care of someone who had been thinking about how to phrase something. "But he came and found Okafor about an hour ago. Apparently he wanted to understand from a clinical standpoint what had happened in the hallway, what had actually been done for him." She paused. "Okafor told him." Elena waited. Vane asked who made the medication decision that Okafor said was the critical one. Okafor told him that too. Priya looked at her. "Vane's been in his room since then. His assistant has been in and out twice. And about 40 minutes ago, his legal team sent a formal letter to the board of directors." "Doing what?" "Withdrawing his current donation commitment and conditioning any future support on what he called a full and transparent accounting of the institutional conduct issues that have been identified today." Priya let that land. "He's also asked to speak with you." Elena looked toward the VIP wing corridor. She thought about the man on the gurney with his eyes open and frightened, asking if he was dying. She thought about what it cost a person of his particular formation to ask a question like that, to have the careful structure of his self-presentation stripped down to something that basic. She thought about what it cost him now to make that call to his legal team. She didn't think it made what he'd said to her acceptable. She didn't think one afternoon of fear and medical dependency erased 11 words spoken in a tone designed to diminish. She wasn't there yet. She might not get there. But she thought about Sandra Oren sitting at her desk for 4 years, building a file, and what finally moved her to send it. She thought about the specific way that something, not forgiveness, not exactly, but something, sometimes arrived not from a place of abundance, but from exhaustion. From the simple decision to stop carrying what you didn't have to carry anymore. "I'll talk to him," she said. She was still looking toward the corridor when the alert from the Federal Secure Network arrived on her phone. She glanced at it. Resco's ID. An attachment and 3 words above it. She opened the attachment. It was a personnel file. Active, not archived. Her name at the top, her photograph from 11 years ago, and below that a status field that read something she had not seen in 11 years. She read it twice. Her hand was not shaking anymore. She looked at the corridor, at the lobby full of people returning to their work, at Priya watching her with the expression of someone waiting to find out what the next thing was going to be. The status field said, "Active, reinstated." And below that, in the field reserved for assignment notes, someone, Rees, she assumed, or someone acting on his instruction, had typed 9 words. Assignment pending, subject to Captain Cross's own decision, no pressure. She put the phone in her pocket. The lobby was very loud all of a sudden, or maybe it had been loud this whole time and she was only now hearing it clearly. The ordinary human noise of a building full of people at the end of an extraordinary day, still here, still working, still showing up. She walked toward the VIP wing. The VIP wing corridor had the particular quiet of a space where something large had happened and the air hadn't fully settled yet. Elena walked through it the way she walked through most things. Not slowly, not hurrying, with the deliberate pace of someone who had decided where they were going and saw no reason to perform urgency or reluctance about it. Vane's room was at the end of the hall. The door was partially open. She knocked on the frame anyway, because that was what she did, and waited. "Come in," he said. He was sitting up in bed with no tablet, no phone visible, no presentation of occupying himself. That was different. In her previous experiences of him, both of them, which felt like they belonged to a different week rather than the same day, he had always been doing something, managing something, the constant low-level performance of a man who needed to demonstrate that he was never not in motion. Now he was just sitting. His color was better than it had been in the hallway. His eyes were tired. Elena came in and stood at a reasonable distance from the bed, not the clinical proximity of a working nurse, not the social distance of a visitor, somewhere between. "I'm told you wanted to speak with me," she said. "I did." He looked at her for a moment, at her face, at the scars along her jaw and neck, which were the same scars they had been this morning, which would be the same scars they had always been. He didn't look away from them this time, and she noticed that and filed it without comment. "I owe you an apology." She waited. "What I said to you last night was, it was wrong. It was cruel. And I knew it when I said it." He stopped. There was something working in his expression, the specific discomfort of a person not accustomed to saying things like this. "I want you to know that I knew it when I said it. I'm not someone who didn't understand what I was doing." "Why are you telling me that?" she said. He seemed slightly surprised by the question. "Because it's true. I know it's true. I'm asking why you want me to know that you knew." He was quiet for a moment. His hands moved on the blanket, a restless adjustment. "I suppose because saying I didn't know would be a different kind of insult." She considered that. It was a more honest answer than she'd expected. "Okay," she said. "Okay? I hear you." She moved to the monitoring equipment out of habit and checked his current readings. Steadier, the rhythm cleaner, the pressure numbers in the range where Okafor would be satisfied. The clinical reflex was automatic by now, inseparable from her presence in a room with a patient. "Your cardiologist wants to keep you for observation through tomorrow. You should let him." "I intend to." He watched her check the monitor. "Dr. Okafor told me what you did. In the hallway. I did what the situation required." "He told me that too. He said you'd say that." Vane looked at the window. The harbor was dark now, the lights of the city reflecting off the water in the particular way they did at this hour. "He also told me the medication decision you made was the one that mattered, that the other interventions were supportive, but that specific decision was the one." Elena said nothing. Okafor was technically correct, but the framing was the kind that made clinical work sound more individual than it was, and she had never been comfortable with that framing. "You could have walked past me," Vane said, "when I went down." "No," she said, "I couldn't have." He looked at her. She met his eyes directly. "Not because of you specifically," she said. "Because of what I am. That's not a statement about my character. It's just, you can't undo 11 years of what the body learns to do. I would have caught anyone." He nodded slowly. He was processing something. She could see the machinery of it, the way a person who has spent a lifetime making assessments and calculating positions was trying to apply that same machinery to a situation that those tools weren't built for. "I've asked my legal team to withdraw the donation commitment," he said. "You probably already know that." "I heard." "I've also asked them to draft a formal statement requesting the board conduct an independent review of the HR practices under Halstead's administration. Not just your case. All of them." He paused. "The 14 cases your secretary referenced. I want those looked at." Elena looked at him carefully. "What changed?" The question was not hostile. It was genuine. He was quiet for long enough that she thought he might not answer. Then he said, "I'm 71 years old and I've been having a heart attack on a hospital floor being caught by a woman I told was not fit to touch me." He said it flatly. The flatness was not deflection. It was the particular tone of a person making themselves look at something without softening it. "That gives you a fairly clear view of what you actually are." She didn't offer him absolution. She wasn't positioned to do that. and she didn't think he was asking for it. What he was doing, she thought, was something more private. The reckoning a person has when the story they've told about themselves runs into an event that the story can't account for. She understood that, in a different way. She had done her own version of it more than once. "The statement you're drafting," she said, "make sure it addresses the prior complainants whose external cases were dismissed, the ones who had documentation produced against them from inside this hospital. They're the ones who need the most direct action." He looked at her. Something in his expression shifted. Not surprised exactly, but recalibrated. "I'll make sure of it," he said. She nodded. She picked up her bag from where she'd set it near the door. She stopped. "Mr. Vane?" she said. Not warmly, not coldly, just directly. "The apology is noted. What you choose to do with the rest of it is your own work." She walked out. Imasus. Sandra Oren was in a small office on the second floor that had been repurposed for the federal team's use for the day. 2 chairs, a folding table, a laptop with a federal seal on the login screen. The witness and the labor advocate Reeves had sent were still present when Elena arrived, but they stepped out without being asked, which told her Reeves had anticipated this meeting. Oren looked like a person who had been wrung out and then ironed flat. Her composure was intact in the formal sense, posture straight, expression controlled, but underneath it, Elena could see the tremor of someone who had spent 8 hours in sustained professional and personal terror and was still deciding on a minute-by-minute basis whether the decision they'd made was survivable. Elena sat down across from her. "You don't need to say anything," Oren said immediately. "I know," Elena said. "I wanted to be in the room." Oren looked at her. Her eyes were very tired. "I almost didn't send it." "I know that too." "I had the message drafted for 3 weeks. Since the Tran case, there was a pharmacist, Michael Tran, last March. Halstead terminated him for—" She stopped, reorganized. "The grounds were fabricated. I documented it. I documented all of them, and I kept the file on a personal drive, and I told myself I was waiting for the right moment." "What made this morning the right moment?" Oren was quiet for a second. "You looked at him when you said it. When you said you wouldn't apologize for the scars that saved lives." She pressed her lips together. "You looked directly at him, not like you were challenging him, like you were just stating something that was true. And then you left." She looked at her hands on the table. "I've been in that building for 9 years. I have never seen anyone say no to Victor Halstead and then just leave the room like it was finished." Elena sat with that. She didn't know what to do with it. The idea that a moment she had experienced primarily as exhaustion and the end of her patience had looked from the outside like something else, like resolve. She supposed they could be the same thing sometimes. She supposed the difference between giving up and standing your ground was sometimes just which direction you were facing when you ran out of energy. "Your file is with 3 oversight bodies now," Elena said. "Reeves' office has a federal labor advocate assigned. You won't face this alone." "I know." Oren looked up. "He's going to say I falsified it. He'll say I had a grievance against him, that I manipulated the documentation." "He can say that. The documentation includes contemporaneous timestamps, unaltered email headers, and in 6 of the 14 cases, secondary witnesses whose accounts you recorded at the time of the incident." Elena met her eyes. "You built the file correctly. I looked at enough of it on the transport to see that." Something in Oren's face changed. A very small thing. A slight release around her eyes, the specific relief of a person being told that the thing they were most frightened of getting wrong, they got right. "It took me 4 years," she said, and there was something rueful in it, complicated. "Yes," Elena said. "It did." She didn't add anything to that. She didn't tell Oren that it was okay or that 4 years was understandable, or offer any of the reassurances that people offered in these situations to make everyone more comfortable. Oren knew what 4 years meant. She'd lived inside it. She didn't need Elena to manage it for her. "What happens now?" Oren asked. "To you." Elena looked at the window. Outside, the city was fully dark now. The harbor lights doubled in the water, the familiar geography of a city she had been living in for 2 years and had quietly grown to know. I'm not sure yet, she said, which was honest. She did not tell Oren about the message on her phone. That was private. That was a decision she hadn't made, and she had learned, both sometimes painfully, not to talk about decisions before she'd made them, because talking about them too soon gave them a shape she hadn't chosen. She stayed with Oren for another 20 minutes. Not to comfort, not to debrief, just to be present, because sometimes the most important thing you could offer someone who had done a hard thing was simply to not leave them alone with it immediately. The hospital's administrative board convened a special session the following morning. Elena was not in the building for most of it. She had gone home, to the apartment she'd been renting since the transfer to Harborview Crest, a third-floor place with windows facing south and a kitchen that was slightly too small. And she had slept for 7 hours without waking, which was the first time in longer than she could specifically remember. She had called Miriam at 6 in the morning and talked for 45 minutes. She had not told Miriam everything. She had told her enough. Priya sent her a series of messages throughout the morning that functioned as a running account of what was happening inside the building she wasn't in. Board is in session. Yi is asking questions. Legal counsel apparently spent the night reading Oren's file. He looks like he had a rough night. Halstead submitted a formal resignation at 8:47 a.m. For personal reasons. No statement. Elena read that one twice. She set the phone down and looked out the window. A resignation was not the same as accountability. She knew that. A formal resignation was, in many cases, the institutional mechanism specifically designed to allow people to exit before accountability caught up with them, taking their severance and their managed narrative with them. She had seen it before. It was how institutions protected themselves and, in the process, the people they should have stopped protecting. But Reeves' referral to the state attorney general was not contingent on Halstead's employment status. The Federal Labor Board filing was not contingent on it. The 14 cases documented in Oren's file were not undone by a resignation letter submitted at 8:47 in the morning with no statement. She picked the phone back up. Does the resignation affect the referrals? Priya's response took 3 minutes. Forsyth's team says no. The referrals are independent. He's still the subject. Another message 2 minutes later. Also, Yi has been appointed interim director pending board review. She accepted. Apparently, she's been waiting for someone to ask her for about 6 years. Elena put the phone in her pocket and made coffee. At 11 in the morning, she went back to the hospital. Not because she had to. She was not on shift. Her reinstatement had been formally processed by HR, a different HR officer, not Oren, who was on documented leave pending the review. And she had been told that her return to active duty was entirely at her own discretion regarding timing. There was no pressure. Those 9 words had meant something. She went back because she had unfinished business, and because she had learned that unfinished business had a weight to it that didn't diminish just because you were physically away from it. She found Okafor in the physician's lounge on the 4th floor, eating a sandwich with the concentrated focus of a man who had been awake since 4 in the morning and was treating lunch as a medical intervention. "How's Vane?" she said. "Stable. Rhythm's been clean since 0200. I'm cautiously optimistic, which in my experience means something will go wrong shortly." He looked at her. "How are you?" "Working on it." "That's what all the nurses say." He set down the sandwich. "I want to tell you something, as a colleague." She sat down across from him. "What you did in that hallway yesterday, catching him, the medication decision, the cardioversion prep, that was textbook. Better than textbook, actually, because textbook is the version that assumes you have the right resources and the right conditions, and you did it without either." He met her eyes. "I've been a cardiologist for 19 years, and I am not a man who gives out compliments about clinical work easily, because I think it breeds complacency." "I've noticed," she said, "but I want to be on the record, with you specifically, as having said what you did was excellent." He picked up the sandwich again. "That's the end of the compliment. Now I'm going to eat this before someone codes." She stood. "Thank you, Felix." He waved a hand without looking up. She walked out. The hallway outside the lounge had a window that looked down into the main lobby, and she stopped at it for a moment. Below, she could see the ordinary mid-morning movement of the hospital. Patients being transported, family members navigating to waiting areas, the endless quiet choreography of a building that existed to manage the worst moments of people's lives and tried to do it with some measure of competence and care. She had worked in this building for 2 years. She had learned its rhythms, its personalities, its specific institutional frustrations, and its specific moments of genuine excellence. She had watched nurses work 18-hour stretches and not complain about it. She had watched orderlies treat patients with more fundamental human dignity than some of the physicians above them in the hierarchy. She had watched the building do what hospitals do, which was fail in some ways and succeed in others, on a continuous, simultaneous basis. She thought about the personnel file on her phone, the status field that said active, reinstated, the 9 words below it. She thought about a burning hillside and the specific sound of a helicopter in structural failure and the decision she'd made, not bravely, not heroically, those were other people's words for it, but simply because the calculation was clear and the alternative was something she couldn't live inside. She thought about whether the thing that had made her turn back toward the burning wreckage 11 years ago was the same thing that had made her stay in Halstead's office that morning instead of agreeing to the apology. Whether the same underlying mechanism operated in both situations scaled to context. She thought it probably did. She had spent 11 years telling herself that leaving the military was a clean decision, made for clean reasons. The injuries, the recovery, the need for a different kind of life. Some of that was true. What she had been less honest about until recently was that she had also left because she had been told, in the careful language of military medical administration, that her injuries had made certain aspects of operational work inadvisable, and that she had been offered a medical separation before she'd had the chance to decide for herself what she could and couldn't do. She had accepted it. She had come out the other side into nursing and built something real, and had told herself that was enough. Maybe it was. Maybe the question of whether it was enough had changed. She pulled out her phone. She opened the message from Resco and read the 9 words again. Assignment pending. Subject to Captain Cross's own decision. No pressure. She typed a response, 3 words, sent it before she could revise it into something more complicated. I'm still thinking. Resco's response came back in under a minute. Take the time. We're not going anywhere. She put the phone away and walked downstairs. General Forsyth was in the lobby, preparing to leave. 2 of his people were with him, managing the equipment cases that had been staged near the entrance. He saw Elena coming down the stairs and waited. Captain, he said. General, are you headed out? The secretary asked me to pass something to you before we cleared the building. He reached into the interior pocket of his jacket and produced an envelope, plain, sealed, her name written on the front in the kind of handwriting that belonged to someone who had learned to write in a different era. He held it out. She took it. He said to read it when you're ready, Forsyth said. Not before. She looked at the envelope. Is this an order? The corner of Forsyth's mouth moved. Call it a strong suggestion. He nodded to her. A precise, deliberate nod, the kind that meant something specific between people who understood the language of it, and walked out with his team. Elena stood in the lobby with the envelope. Around her, the mid-morning movement continued. A child ran across the lobby floor toward a woman who was probably the child's grandmother, the sound of small feet on polished stone. 2 nurses she recognized from the 3rd floor walked past, talking about something not work-related, laughing at a private reference. The coffee cart near the main entrance had a short line. She walked to a chair near the window and sat down and opened the envelope. The letter inside was 2 pages, handwritten, which surprised her. She had expected something typed and formal. What she found instead was the handwriting of a person who had chosen the slower, more deliberate form because the content required it. Reeves wrote about the morning of her extraction, not the parts that were in the file, those she knew, but the parts that came after. The debrief testimony given by the 4 soldiers she'd extracted, which had been classified since the day it was recorded. He wrote about what they'd said, in their own words, about what they'd seen her do, about the sequence of it, and what it had actually looked like from where they were. The men she was pulling out of a burning aircraft while the aircraft continued to burn. She read it without stopping. Her hands were steady. He wrote about a decision that had been made after her medical separation, a decision made at a level above Reeves's authority at the time, which he named without equivocation, to classify her file in a way that effectively erased her from the operational record, not because her actions were shameful, but because the mission itself was classified, and the simplest administrative approach was to classify everything attached to it, including her. He wrote that this had been wrong, not in the careful bureaucratic language of institutional admission, but plainly, in the direct language of a person who believed in accountability in both directions. He wrote, "You were owed recognition that you did not receive. I cannot give you back the 11 years during which you did not have it. I can make certain the record is corrected, and I have done that. The rest is yours." The last paragraph was shorter than the others. "Whatever you decide about the reinstatement, Captain Cross, I want you to understand one thing. The scars are in the record now, not as an explanation or an apology, as what they are, evidence of service. They belong to the nation's accounting of its own history, and that accounting will not be reclassified again. I've seen to that personally." She folded the letter and put it back in the envelope and held it in her lap for a moment. Below the window, she could see the harbor. The mid-morning light was doing something to the water that was neither beautiful nor harsh, just present, the ordinary light of an ordinary Tuesday working on the surface of things. She thought about her sister Miriam, who had driven 4 hours to meet her at the military hospital where she'd been recovering, who had sat beside her bed for a week without being asked, and had never once told Elena how to feel about what had happened, only that she was there. She thought about Priya, who touched her arm in a hallway and didn't say more than was necessary. She thought about Corporal Penn in a converted building in Marengo County, managing a hard situation with inadequate resources and keeping 2 people alive through the night. She thought about Sandra Oren at a desk for 4 years, building a file, choosing finally to send it. She thought about the specific thing that all of those people had in common, which was not extraordinary courage in the cinematic sense, but the ordinary grinding commitment to continuing, to showing up, to doing the work, to not allowing what had been done to them to determine what they would do next. That was the thing. Not the grand gesture, not the single dramatic moment. The continuation. She had been continuing for 11 years. She would continue now. She was not the same person who had gone into Halstead's office that morning with her locker packed. She understood that. The morning had done something to the surface of her life, had shifted the arrangement of things in ways she hadn't finished understanding. She had been seen, fully, publicly, in a room full of people who knew her only in one dimension. And the experience of being seen was not only relief. It was also the particular vulnerability of a person whose private weight has been named aloud. She would need time with that. She would need the kind of time you spent alone with something, turning it over, understanding what shape it was now that it was out in the light. But she was not afraid of it. She stood up and walked to the nursing station on the main floor, where the day charge nurse, a man named Bobby Tirado, who had been at Harborview Crest for 12 years and had the particular institutional memory of someone who'd seen everything twice, looked up when she approached. "Cross," he said, "you're not on today." "I know." She leaned on the counter. "Do you need hands?" He looked at her for a half-second with the evaluative speed of a charge nurse doing the mental math of shift coverage and clinical need. Then he pulled up the board. "Bed 7 on the 3rd floor needs a new IV. The one in bed 12 is asking for the 3rd time to see his results, and the attending isn't here until 2. And there's a woman in the family waiting area who's been there since 6 this morning, and nobody's checked in with her in the last hour." "I'll take the waiting area first," Elena said. Tirado nodded, pulled a badge from the drawer. A temporary one, her permanent having been already reprocessed by HR, but the temporary would work for today. He handed it to her. She clipped it to her scrubs. The woman in the family waiting area was 58 years old, with the exhausted posture of someone who had been waiting through the night and into the morning for information that kept not arriving. Her name, she told Elena, was Patricia. Her husband had come in the previous evening with chest pain, and she hadn't been able to get a clear update since midnight. Elena sat down next to her, not across from her. Next to her. "Tell me what you know so far," she said. Patricia told her. The telling took about 7 minutes and included things that weren't medically relevant, but were clearly the things Patricia most needed to say. That her husband had been resistant to coming to the hospital, that she'd had to argue with him, that she was afraid of being right about how serious it was. Elena listened to all of it. She did not redirect toward the medical information until Patricia had said what she needed to say. Then she walked her through what the clinical picture likely meant, in plain language, without false reassurance and without unnecessary alarm. She went to the nurse's station and got an actual update from the attending's notes, and came back and delivered it accurately. Patricia looked at her face, at the scars, with the frank, tired look of a person who was beyond the social management of their own reactions, and said, "What happened to you?" "A long time ago," Elena said. "I pulled someone out of a fire." Patricia nodded, like that was a complete sentence. "Thank you for sitting with me," Patricia said. "Of course," Elena said, and meant it. 3 weeks later, the State Attorney General's office announced a formal investigation into administrative practices at Harborview Crest Military Medical Center, naming Victor Halstead as the primary subject and citing evidence compiled over a 4-year period by a current hospital employee. The announcement did not name Sandra Oren at her request, but the investigation it described was entirely built on what she'd spent 4 years building. 2 of the 3 prior complainants whose external cases had been dismissed engaged legal representation the week the announcement was made. The third had moved out of state, but issued a public statement from there. Marcus Vane was discharged 6 days after the cardiac event. His formal statement to the board, which had been drafted carefully, reviewed by his legal team, and then, according to his assistant, revised significantly by Vane himself before submission, named specific failures in the institution's complaint and HR processes and conditioned the resumption of any donor relationship on the completion of the independent review and documented remediation. It was, by the assessment of Dr. Constance Yi, who read it in her new capacity as interim director, more direct than I expected and more useful than it needed to be. Yi sent Elena a 1-line message after reading it. "He's better than I thought." Then, after a pause, a second message. "Most people are when they stop performing." Elena kept that. She didn't know why exactly. It seemed like a thing worth keeping. Sandra Oren returned to work 5 weeks after the event. She was reassigned to report directly to the interim director's office while the review was ongoing. On her first day back, Elena found a small envelope on the nursing station desk with her name on it. Inside was a card with 3 sentences. "I built the file because it was the right thing to do. I sent it because of you. The rest I did for myself." Elena read it twice. She put it in the pocket of her scrubs and wore it there for the rest of the shift, the small weight of it against her side. She told Resco her decision on a Wednesday morning, in a phone call that lasted 11 minutes. She was not going back to active operational status. That was a real decision, made after real consideration, and it was not a loss. It was a clarity. She was 41 years old and her left shoulder had a specific limitation that she'd stopped pretending wasn't there. And the work she'd found in the intervening 11 years was not a consolation prize. It was work, good work, work that required everything she had and returned something genuine. What she agreed to instead was a consultation role, medical advisory. The specific intersection of military trauma medicine and civilian clinical practice, which was a gap that existed in a way most people in both systems didn't fully understand because they didn't move between them. She had moved between them. She knew the shape of the gap. Resco listened. When she finished, he said, "That's what Reeves expected." "Is that a problem?" "It's the opposite of a problem. He drafted the position description 3 days ago." She laughed. Genuinely, briefly, the specific laugh of a person being outmaneuvered by someone they don't mind being outmaneuvered by. "Of course he did." "He's thorough," Resco said. "He's thorough," she agreed. On the last day of her temporary assignment at Harborview Crest before her new role began, Elena worked a full shift on the 3rd floor. It was an ordinary shift in most respects. Medication rounds, IV management, a patient who needed someone to explain his discharge instructions 3 times before they landed, 2 moments of genuine clinical concern that resolved, one that didn't and required escalation. At the end of it, Priya found her in the locker room. "So this is it," Priya said. "For now." "For now." Priya leaned against the lockers with the posture of a person who had more to say and was deciding how much of it to say. You know what the worst part of this whole thing has been? Elena raised an eyebrow. That I'm going to have to break in a new person in that wing who probably won't catch medication errors before they're prescribed. Priya pressed her mouth together against something that was almost certainly a smile. It's very inconvenient. Elena closed her locker. You'll manage. I always do. It's exhausting. Priya straightened. She looked at Elena with the directness that had always been one of her best qualities. Not sentimental, not performing warmth, just genuinely present. You did something important here. I want you to know I think that. Not the hallway, not the arrhythmia. I mean the thing in Halstead's office, the thing you said. Elena picked up her bag. I was tired. I know. Priya touched her arm, the same gesture as the first night, the same quality of contact, present without demanding anything. Sometimes, that's exactly when it matters most. She walked out through the main lobby. The lobby was busy in the way it was always busy at shift change. The overlap of arriving and departing, the brief compression of information and responsibility moving between people, the small daily miracle of a building full of strangers choosing to show up and do difficult things because someone had to. She did not walk slowly. She did not linger. She walked out the way she had walked into the building every day for 2 years, at the pace of someone going somewhere, carrying what she needed. The evening air was cooler than she expected. The harbor was doing what the harbor always did, which was exist without commentary. The water dark and moving and indifferent to the individual human dramas occurring along its edge. She stopped on the steps, not to look back, just to be still for a moment before the next movement. The scars on her face caught the light from the entrance behind her. She had stopped noticing that a very long time ago. She noticed it now, briefly, the way you notice something you've lived alongside for so long it has become part of the landscape, and then she was aware that she was noticing it differently than she used to. Not with the practiced neutrality she had developed to manage it, just as what it was. Part of her face. Part of her. The record written on the outside of her body of something that had happened a long time ago, and that she had survived and that had cost her something real, and that she would not trade. There were things that people never told you about being the person who goes back into the fire. They didn't tell you that it didn't feel brave when you did it. They didn't tell you that you spent years afterward wondering if you'd made it mean something, or just used the meaning that other people attached to it as a substitute for the harder work of understanding yourself. They didn't tell you that the scars were not metaphorical and did not stop hurting when the weather changed, that the shoulder ached in specific, predictable ways, that the story of what you did and the reality of what it cost you were not the same story, and learning to hold both at once was its own lifelong project. And they didn't tell you that the moment you stopped carrying what you didn't have to carry, the shame that was never yours, the apology that was never owed, the small daily accommodations you made to people's discomfort, you would feel not lighter exactly, but more accurately sized, like yourself in a way that you'd been approximating for a long time without knowing it. She had refused to apologize for scars that saved lives. That was what Sandra Oren had seen. That was what had moved in the room. Not heroism, not performance. Just a woman who had decided that the particular version of small she'd been asked to make herself was not something she was willing to do anymore, and who had said so plainly and walked out. The simplest things were always the ones that changed the room. She went down the steps and walked toward the street. She had a phone call to make to Miriam. She had a position description to read tonight and questions she'd want to ask Reeves in the morning. She had a shoulder that needed ice and a kitchen that was slightly too small, and a window that faced south, and a photograph of herself and her sister at a kitchen table, both of them laughing at something she still couldn't remember. She had work to do, good work, the kind that required everything she had. She walked. The city was lit and moving around her, the ordinary evening of a place full of people living their ordinary difficult lives, and she was one of them, moving through it with her face to the light, carrying nothing she didn't choose to carry. That was enough. That had always been enough. She had just needed to remember it.